what, in terms of Representative Bacon's bill, what for nurse practitioners, what does it really mean, and what would it do?
Well, currently in statute, what is required for a nurse practitioner to be able to provide primary care services is a contract with a physician. And what that contract states is that 5% of prescriptive charts need to be reviewed weekly. So currently, nurse practitioners are practicing independently and providing primary care services. So this bill actually does not change that. It just removes the regulatory burden of the 5%.
What are your thoughts on the bill? Do you like the bill? Not like it?
We're absolutely in support of the bill. There are actually 22 states right now that do not have a practice agreement for a nurse practitioner or an APRN to practice, and Indiana would be in line with them if they retired that particular regulatory contract, so to speak. And what it does is it actually prevents access to primary care. Most nurse practitioners and APRNs are having a really hard time finding a physician to meet this regulatory requirement, and so many of our counties go without primary care services.
Last night, several doctors told me right now under current state law that basically nurse practitioners have to be supervised, if you will, under doctors, and they didn't like the bill for two reasons. One, saying that graduating nurse practitioners don't really go to rural areas, they go to urban areas like doctors do. And the second reason was that they brought up the experience of nurse practitioners, saying they prefer that families have the care of a physician. Uh, they say they prefer that families have teams that are physician-led.
Correct. So one of the arguments that has been brought up more nationally, not just in Indiana, is team-based care. And so physicians are very much supportive of team-based care and the physicians being the leader of the team. We absolutely support team-based care, but what we want people to consider is that the leader of the team might vary based on the actual patient's needs. So that could be a physical therapist, that could be a nurse practitioner, or that could in fact be a physician. So I don't think the leader absolutely has to be a physician. It should just be who is the best to lead that particular care of that patient at that particular time. So this bill doesn't in no way prevent team-based care, collaboration amongst healthcare professions. That happens every day, and that's actually best practices. What this bill prevents is the licensure coupling of two providers that would in fact that limits, again, like I said, access, because there are a shortage of physicians and to meet that requirement for nurse practitioners. The other thing that you had mentioned was that physicians were worried about us providing specialized care. APRNs, specifically nurse practitioners, go to primary care programs, including family, pediatrics, women's health, psychiatric care. And so those are the populations that we are specializing or trained to provide care in. We are not cardiologists, we are not neurologists, we are not dermatologists. So we would not be going out providing care specific to those services independently.
And you were telling me that in current Indiana law, nurse practitioners don't need to be supervised by doctors.
Correct. Current Indiana law does not require supervisory requirement for nurse practitioners to be able to provide those services. We actually are trained in a master's or graduate prepared program, and we are licensed registered nurses in the state of Indiana. That is a requirement to practice. We are also certified in our area of specialty. So we have taken a very rigorous national board certification in order to be able to verify that we have the skills and training to provide these services. And that would not change whether this law passes or does not. That is unchanged.
And then my last question. Representative Bacon, he pulled the bill from third reading yesterday, so he didn't get a House vote. He told me because he's going to sit down more so with physicians groups and see what they want to put in the bill, and then take the best of his bill and a Senate bill, and kind of work them into a new proposal and present that. in the coming days. What are your thoughts on that?
That actually has already been done. And so we have met with our medicine counterparts and put amendments in the bill already that were suggested and that were a negotiation amongst the two organizations to ensure that the concerns that they had were being met, and also to ensure that it still would open up access to primary care services. And so it's unfortunate, though, that has still not been supported by medicine, even though in fact those negotiations have already been done. The other thing I wanted to mention, you had said that APRNs or nurse practitioners are not practicing in rural areas. And again, they're not because they can't find a physician to meet that requirement. In other states that have retired their practice agreement, they actually have had a huge increase in the workforce of nurse practitioners and APRNs, anywhere from 40 to 80%. And the majority of those APRNs have moved in the rural areas. And so right now what you're seeing is geographic clustering of healthcare professionals. They're moving to where they can get a practice agreement, not because that's truly where they only want to practice at.